Good morning, one and all. Today we'll be talking about the various imaging modalities of the various paranasal sinuses. Now, apart from the intraoral radiographic techniques in which we use intraoral periapical radiographs and occlusal radiographs, which show part of the maxillary sinuses or the sphenoid sinuses or the various other paranasal air sinuses. Now, it is mandatory for us to, if at all we have to view the total paranasal views in the total perspective for the any kind of pathology demonstrable, it is mandatory for us to take an extraoral radiography wherein we have to use different kind of modalities wherein specific kind of paranasal sinuses can be viewed easily. Now, among them, today we'll be talking about the most commonly used extraoral radiographies which can demonstrate pathologies in relation to the various paranasal air sinuses. So what in these paranasal sinuses, we know these are basically large air-filled cavities, out of which the what we have are the maxillary sinuses, the frontal, the ethmoidal, and the sphenoidal sinuses. Now, sphenoidal sinuses is only one; it is unpaired, whereas all the other three sinuses are paired. Now, this is the anatomical location of the various paranasal sinuses. We can see the triangular-shaped maxillary sinus in the maxillary bone, the ethmoidal air sinuses. Now, among the ethmoidal bone of which is a part of the cranial bone. Now, the frontal sinuses in the frontal bone itself, and the sphenoid sinus, which is placed deeper within at the base of the cranial cavity, is a single unpaired kind of paranasal sinuses. Now, this is a frontal as well as a lateral projection of these sinuses. Now, among these, the most common kind of extraoral radiographies which we use. The first one is the lateral cephalogram or the lateral skull radiography, which is the most common kind of extraoral radiography which is used and is also most useful, as in all the four sinuses can be viewed without any hindrance on this particular radiograph. Now, as the name suggests, it is a lateral kind of skull radiography. The central ray of the X-ray passes lateral and perpendicular to the sagittal plane. As you can see in this animation, it depicts the central ray, which is depicted by the blue arrow, hits perpendicular to the sagittal plane, going through the tragus of the ear, which is then projected upon an 18/24 extraoral radiography. Now, among these, the technical factors, we use a moving or a stationary grid. Along with that, commonly use 65 to 75 kVs and a small focus spot as necessary for or any kind of radiography. In these, this is the final structure which is shown, wherein you can easily make out all the four paranasal sinuses. You can see the first one, which is the largest of among all. There is the largest air-filled cavity within the maxillary bone. You can see over here, that is the maxillary sinus. Now we can see the ethmoid sinus placed just above to the maxillary sinus in the ethmoidal bone. Now we can see the frontal sinuses in the frontal bone right in front, ahead of all other sinuses, and sphenoid sinus right at the back, which is just placed beneath the base of the cranial vault. You can see the sphenoid sinus over here, which is very small, and it is very hard to make out in any other kind of radiography, wherein this particular radiography, lateral skull radiography, gives out a clear view of any pathologies associated with the sphenoid sinus, especially in any kind of leaf fractures, wherein a suspected fracture of the sphenoidal sinus walls might lead to various other complications. The other most common is a PA projection, also called as a Caldwell projections, wherein it is nothing but a kind of as the name says, it's a posterior anterior view. That is, the central ray has to enter from the back of the head, from the parietal bone, and exits out through the front along the sagittal plane. Now you can see how the positioning of the head is there, which is a forehead nose position. That is, your X-ray receptor, your image receptor has to be placed right in front of the patient, touching both the forehead as well as the nose. So it is a vertical placement. Now it has to be perpendicular at 90 degrees to the sagittal plane, and the central ray passes from the parietal bone from behind the patient and exits out from the front. Now the placement, the line passing from the canthus to the lateral canthus to the tragus of the ear, that is placed at a angulation of 10 to 15 degrees, and then the resulting radiograph seems something like this, wherein you can easily make out the frontal sinus. As you can see, well developed the frontal sinus right in the frontal bone. Now then we can see the anterior ethmoidal sinus. Now the anterior, middle and the posterior ethmoidal sinuses are the various parts of the ethmoidal paranasal sinuses, wherein all the three can be visualized in the lateral skull radiography. But in this kind of radiography, where is a PA Caldwell's view, we can view the anterior ethmoidal aces placed right in the ethmoidal bone. After that, we can see the maxillary sinus, which gives a part of the view of the maxillary sinus, wherein the anterior wall as well as the lateral and the medial wall can be seen in this particular radiography, wherein the total extent up to the maxillary teeth is not seen in this particular radiograph. Now, as you can see over here, the topmost portion of the maxillary sinus can be seen. The ethmoidal sinus and the frontal sinus can be clearly seen without any bony hindrance. But in case of maxillary sinus, we see a bony hindrance of all the occipital bones, the parietal bones, right from the back of the head is projected onto the maxillary sinus. So this is not a very good radiograph for the maxillary sinus pathologies, but a very good radiography for a frontal sinus pathology as well as an ethmoidal sinus. And obviously, since because of heavy bony hindrance upon the radiograph, the sphenoidal sinus is totally obscured in this kind of radiograph. Now, next we have a sinus Waters view. It is primarily used to take the maxillary sinus. As you can see, the previous radiograph, wherein the PA Caldwell view can easily visualize out the frontal as well as the ethmoidal sinus, but the maxillary is totally obscured. So in view of keeping the maxillary sinus to be the most affected kind of paranasal sinus, a radiographic technique has been developed to view only the maxillary sinuses without any particular hindrance. Now that is the Waters view. Now you can see how the head is bent backward. Now the head being bent backward, what we are trying to do is we are trying to move out the bony protuberances or the bony hindrances of the cranial vault or the cranial base out of the line of projection of the central ray. That is, we are trying to bend it away from the central X-ray, so that the maxillary sinus can be viewed is pushed upward and it can clearly projected onto the image receptor. Now the slight difference, slight modification of this Waters view, we have the submental vertex projection. Now in this we can see what is the final radiograph. What we see in a submental vertex projection is primarily made out to view the sphenoidal A sinuses. As I was talking about the maxillary sinus, how the lifting of the head will project out this maxillary A sinuses from the maxillary bone onto the image receptor. It is all at the same time that we are also obscuring the sphenoidal A sinus from the direct view of the central X-ray by bending the head backward. Now, to view the sphenoidal aces from top and bottom, we have to bend the head even more back. That is, we have to put the sagittal plane at almost parallel to the floor, and the coronal plane has to be parallel to the image receptor. Now that is the submental vertex, wherein we can clearly view the sphenoidal A sinus without any hindrance, either from the frontal bones or the maxillary bones, or the cranial parietal bones or the occipital bones. So we are viewing the sphenoidal A sinus directly from down below. That would be the submental vertex view. So in any case, if you have to find out information from any kind of pathology associated with a specific kind of A sinus, now since this is just a 2D image of a 3D structure, we have to combine the information or the interpretation of radiographs from two particular views, which are preferably at 90 degrees. Now for example, if you have to view any pathology of the ethmoidal sinus or the, in this case, a sphenoidal A sinus, we have to take both the submental vertex view as well as the lateral skull radiography. That gives two views at 90 degrees, so that we are also compensating for the lack of third dimension in a radiograph. So combining information using both lateral skull as well as submental vertex we can bring out the total 3D structure of the sphenoidal A sinus, and we can make out any kind of pathology within it. Same is the case for any other kind of sinuses, be it the frontal sinus, be it the ethmoidal or the maxillary sinus, all of which had to be combined with a lateral skull radiography, which is a 90-degree projection to give out a full 3D view. So in this submental vertex, it's basically made out to view the sphenoidal A sinus. The other A sinuses are obscured by this kind of radiography. And apart from that, we also make out any kind of pathologies or pathologies associated with the bony structures on the either side of the mandible. Now the other one is an open mouth Waters method. This is just a modification of the original Waters method, wherein it was primarily used to view the maxillary sinus, but using a closed mouth kind of Waters view. What happened is the mandibular anterior mandible or the ramus was coming in between the projection of the maxillary sinus onto the image receptor. So by opening the mouth, what we are doing is we are increasing the air-filled cavities within the area of interest. That means we are pushing the air into the oral cavity. Now this gives a kind of contrast between the maxillary sinus as well as the air-filled cavity. So in cases of any water-filled or pus-filled kind of cavities within the maxillary sinus, be it from the dental or any other kind of pathologies, we can clearly make out the difference in the contrast between an air-filled cavity, that is your oral cavity, and your pus-filled or a water-filled cavity, which is your maxillary sinus cavity. So both of them are radiolucent, but the difference in the contrast, difference in the grayscale gives an idea as to what kind of pathology is affecting the maxillary sinus. Now, if at all both the radiolucencies are equal and are similar in density, similar in contrast, then we can come to an interpretation saying that the maxillary sinus is normal. There's no kind of a pathology associated. Since whatever was affecting the maxillary sinus was nothing related to the pathology within the maxillary sinus, but it is because of a pathology outside the sinus air-filled cavity. So that is the most important advantage of an open mouth Waters projection, which is a modification. Now these are the most important kind of imaging techniques which have to be used in adjunct with your intraoral radiographies or your occlusal radiographies, and even within the extraoral radiographies we have to use two particular views, preferably at 90 degrees, to make out any pathology related to any of the paranasal sinuses. Thank you.